Okay, so first I look at the mouth and it's pink. There's no cyanosis. Checking into the mucosa, the gums, no bleeding gums, the teeth, there's no any brownish spot, and then also the tongue, the mucous membrane, they're pink color. Okay, can you stick out your tongue for me? So the tongue is in midline. So I'm checking the cranial nerve 12. They are normal. So looking into the uvula inside, can you say ah? Okay, so the uvula ah. So the uvula is also in the midline. And also the pharynx, tonsil is plus 1. Okay, there's no erythema or discharges or exudates there. So I'm also going to check the gag reflex. Can you say ah to me? Say ah. Okay, so it's positive gag reflex. It means the glossopharyngeal nerve, which is the cranial nerve 9, and the 10 vagus nerve, they're intact. Okay, so I finished with cranial nerve 1, cranial nerve 2, which is the eye, cranial nerve 3, which is the consensual right reflex, and there's no ptosis, and also the cardinal movements of the eye, there are 3, 4, 6. I'm finished with the cranial nerve 5, the trigeminal, and also the 7 for the facial. I'm done with the cranial nerve 12, so I'm now left with the cranial nerve 11. So for the neck, first inspection. So the neck, the color, they are normal color, they're symmetrical, there's no lesions, and there's no abnormal pulsations. So can you face over there? So looking at the JVP, it's flat at 45 degrees angle. And so I'm going to palpate now for the carotid pulse. So put your face in the midline, and I will do it one at a time only. So it's regular and it's normal character. So the other one. Okay, they are equal. So can you resist my hand, please? Okay, can you shrug your shoulder? So the cranial nerve 11, the accessory muscles, the one that's supplying the trapezius muscle, they are also intact. Okay, I'm also going to listen for the carotid, if there's any bruit. I'm going to use the bell. There's no bruit, so it's normal. I have to check now for hearing. So I'm going to whisper something 1 to 2 feet away from you. I'm going to cover my mouth. And please let me know if you can hear it, okay? One ear at a time. Tuesday.
Yeah. Yes.
What is it?
Tuesday.
Okay, the other one.
Baseball.
Okay, so it's a whisper test. They're equal. They're normal. Now I'm going to check for the Weber test using my tuning fork. And see if you can hear the tone on both ears.
Yes.
Okay, so Weber with midline and with lateralization. It means that the bone conduction was done by the skull and they're both equal. So I'm now going to check for the Rhines test. Let me know if you cannot hear it anymore. Okay, so I'm doing this on the other ear. Okay, so he showed me that both ears are normal. Using this tuning fork, I was able to check his air conduction and the bone conduction, and normally the air conduction should be longer to hear than the bone conduction. As you can see, there's two types of hearing loss. We have the conductive hearing loss and the sensory neural hearing loss. Under the conductive hearing loss, we have the air conduction loss, hearing loss, and the bone conduction hearing loss. And also for the sensory neural, we have if the organ of Corti is affected, at the same time if the cranial nerves is affected. And for the cranial nerve, if there's a tumor in it, like acoustic neuroma or Meniere's disease, so that's a sensory neural hearing loss. But in my client here, they're all normal, so it means everything is fine. Okay, so next I'm going to check the blood pressure, because I was able to check the blood pressure earlier. So the cup should cover 2/3 of the forearm, of the upper arm, and then so his blood pressure is 100/70, which is normal. The normal should be 120, less than 120/80, and his blood pressure right now is 100/70. So when you get the blood pressure, this hand should be relaxed and it should be at the level of the heart. And this cup should be at the right size. It should cover 2/3 of the upper arm. And then just in case if you saw that there's a high blood pressure, you have to let the patient rest for 30 minutes and take it again for 3 times. Now I'm going to check the hands. First of all, earlier I forgot to palpate for the temporal arteries here, and I can feel its normal quality and its regular rhythm. Checking also the brachial pulse. Okay, they are normal, equal. Radial pulse, normal rhythm, and normal quality. They're strong. And the ulnar pulse. Okay, looking at the hand, the length, they're equal length, color normal, and there's no cyanosis in the finger. Can you do the Scamarot window test to check for clubbing? So it's negative, no clubbing of the fingers. Can you move your fingers with me? Okay, I will now check for tone, muscle tone. So it's non-spastic, not rigid, not flaccid. They're just normal tone. Okay, so after it's symmetrical, size is normal, tone is normal, and the strength now. I'm going to check for the strength. Okay. Okay, can you squeeze my hand? Okay, they are normal strength, so it's 5/5. Okay, now I'm going to check for sensation. Can you close your eyes? So this is the. Can you?
Yeah.
Okay. Can you feel this?
Yes.
What about this?
Yes. Yes.
Okay. I am now going to raise one of your finger and let me know which one, okay?
Left finger.
Left middle finger?
Left middle finger.
Okay. What is?
Right middle finger.
Fourth.
Fourth.
This is fourth, okay?
Yeah,
okay,
fourth.
I'll do it again. Which one?
You raise the index finger on the left.
Okay. Okay, that's okay. And what about this one?
You raise the right hand.
Okay, so it's the normal position sense. And earlier I did the touch, the sensation, there are normal sensation also. Now I'm going to check, since I'm already in the hand, I'm also going to check the reflex. Okay, you can open your eyes. Okay, so it's normal brachioradialis. Okay, so that's normal also. And also the triceps. Okay, normal. Okay. Okay, and here. Okay, it's normal. Okay, and then we will now, since we are in the hand, we will do now the cerebral function. Can you do the rapid alternating movements? Okay. Can you do the finger to nose test? Okay. And finger to finger test. Go up and down. And then close your eyes. Okay, so it's normal. Okay. Can you put your index finger to your thumb and do like that? And the other hands too. So it's a well coordinated hand. Okay, so now I'm done with that. So I'm now going to check the posterior chest. Okay, I'm going to open only the upper part of your posterior chest. First, I'm going to look at the shape, their normal shape, and then the skin color, they're normal, no lesions. I'm going to check for masses or tenderness. Let me know if you feel tenderness. So there's no tenderness or masses, and the temperature, normal temperature. Also, I'm going to check for tactile premiti. So let's say, please say 99, okay?
Okay. 99. 99. 99.
Okay, so it's equal. Now, after palpation, I'm going to percuss. The normal sound should be, the normal lungs should be resonant for percussion. So it sounds resonant to me. Then I'm going to auscultate now using the diaphragm. Okay. Breathe deeply for me. Okay. It's a normal, clear breath sounds, no wheezing. I did not hear any rhonchi or crackles, and no ralls.